We welcome Mark Krasna, Dr. Mark Krasna, Medical Director, Meridian Cancer Care. Good to see you, Doctor.
Thank you. Thanks for having me, Steve.
People don't like to talk about cancer, but we need to.
Absolutely.
Made some progress in the last 20 years, right?
We
Describe
have. Well, basically through what I'll call early detection and screening, we have changed the face of what we see for cancer. No one likes to hear about cancer. No one likes to think of the diagnosis of cancer. But if you imagine that you could find cancer when it's early or when it's advanced, through early detection and screening methods, we've really changed the fact that cancer in America mostly is now something that we're finding earlier, and therefore people can be treated with cure, and therefore people are living longer, despite the fact that they may have had the cancer. So that's the big news.
Let's talk about the areas where we've made the greatest progress with respect to early detection.
Sure. So the two that are the most important, because they're also the most common cancers, are breast cancer in women, prostate cancer in men. In women, we all know that mammograms, screening mammograms, which is a simple X-ray test that's done of the women each year to look at their breast, that has helped pick up tiny cancers to the point that most cancer centers across the country now in the United States are treating early stage breast cancer far more than they treat advanced stage breast cancer. So it's good news because we are picking up people who have the early cancers, but even better news, they can be cured when they're found, as opposed to people showing up only after they found something or only after it has spread, and obviously those patients have a lower chance of cure.
I want to talk about your area of expertise, which again is lung and
esophageal cancer,
which is more challenging. We'll talk about that in a second.
It
But
is.
I debated saying this, but I told you, and you said I should say it on the air,
Sure.
so I will. I just had the it's colonoscopy. You got to do it. You know, you turn 50, then it's every 5 years, right?
Right.
And I told you I got thrown off when the doctor said, "Hey, we found this precancerous polyp," right?
Right.
And he said, "But it's good news because now we removed it, but now you're on a 3-year plan." I go, "Where's the good news?"
Right.
Explain the good news, because you understood right away.
Absolutely, and I was happy as soon as you told me that. A, happy that you did what you're supposed to do. You had your screening colonoscopy, and B, even if they found something, they found a pre-malignant, a non-cancerous polyp. We know that the natural history of that polyp, if you leave it alone, it doesn't just grow, it can spread. And if somebody has an unknown cancer and the cancer spreads elsewhere in their body, unfortunately, the chance to cure some of that cancer is low. So now you're facing the discomfort of having to be, as your doctor called it, on the 3-year plan, every 3 years, have a colonoscopy to make sure there are no other polyps, because typically people who have a tendency may have another one. But even if they found one, God forbid, in 3 years or 6 years, as long as they keep finding precancerous polyps, your chance of, God forbid, having a cancer.
You've got to be advocating for yourself. And let's switch gears, though.
Yes.
Meaning, you understand what I'm saying. And
Absolutely.
I think people do as well. And don't avoid it. Nothing good
And you
happens.
shouldn't avoid it. You turn 50, it's something you absolutely have to
Let's
do.
switch gears.
Yep.
Your area. Because
Lung cancer, we've had the least progress, unfortunately.
Because?
Well, two things, unfortunately. Number one, think of it. Lung cancer is not the most sexy disease to talk about. There's still a stigma throughout the United States, but even across the world. Some people look at the patients as the victims, but they also look at them as, well, you did it to yourself because you smoked. And people need to get over that. They need to realize that the only person who was guilty there was a tobacco company that put nicotine in cigarettes that addicted people at an early age. They're the ones to blame. If someone picked it up and started, unfortunately, it's really hard to stop. So we need to stop thinking of the patient as, the person who was responsible.
But why is it so hard to treat?
Because we did not have any early detection for lung cancer for so many years. So for so many years, people would only show up after the tumor had presentation of symptoms, bleeding, coughing, or pain in the chest. You could guess that.
Late in the game.
Late in the game. And to remove those by surgery, like my specialty, or even to treat them with combinations, which have made great progress. Chemotherapy and radiation therapy and surgery for lung cancer, much better than it was 10 or 20 years ago, but nowhere near as good as if you would identify the cancer early on. So now we have a new technique,
Go ahead.
just approved this year by Medicare, just approved by the U.S. President's Task Force, and it identified that a lung cancer screening CT scan, like you had your screen, CAT scan, simple CAT scan. Nowadays, people know it takes literally 45 seconds to have a CAT scan. That CAT scan in the right patients, high-risk patients who either have emphysema or COPD, or patients with a history of smoking greater than 20 years, those patients are at higher risk. Even if they stop smoking, they're at higher risk. They should have a screening CT scan.
Doctor, help me understand something, because you're a big advocate of what are called nurse navigators, and cancer care with nurse navigators. A couple minutes left. Explain that, why it makes a difference if you, in fact, have the diagnosis of cancer.
So I'm a very strong proponent of what I'm going to call multidisciplinary cancer care. What does that mean, multidisciplinary? Again, take the typical cancer patient where it's a little bit more advanced. You have a medical oncologist who gives chemotherapy, a radiation oncologist who gives radiation therapy. You have a surgeon who resects the tumor, and then you have all these other doctors who help you diagnose it and stage it. So number one, you need everyone's opinion before you start therapy. That's key. You don't want to go someplace, have a treatment, and then find out by the next guy you see, well, that's okay, but I really would have done it different. It's too late. You want to know before you initiate treatment, what does my team of specialists think? What's the right thing for me?
You need a navigator.
And you need a navigator. Her job or his job is to get you through from place to place, from doctor to doctor, from team to team, and also to make sure at the end of the day, did you really understand what we said? Did you get it that you're going to have this test done and then this staging procedure, and then we're going to start you on your complex chemo and radiation, and I'm there for you at every step of the way. My patients, they can't pronounce a navigator either. They say, it's my go-to nurse. That's what they say. I want someone that I could go to whenever I have a problem. And they call the navigator for a social issue, for a problem with their insurance, and of course, if their appointments were canceled because of a snowstorm. But the navigator is the glue that keeps the team together. That's really the key.
30 seconds, real quick. Greatest leadership lesson you've learned in the work that you've done in all these years is?
Listen to the patient and listen to your colleagues. The only way to succeed in something complex like cancer is to have a team. So all of us together can make a bigger difference. And you can't do it alone. No one person can be as successful than a strong team.
You love what you do.
I do.
And you make a difference every day.
Thank you.
Dr. Mark Krasna is the medical director of Meridian Cancer Care. Gave us a great update on the progress we're making in cancer and also told us that early detection is the key. Thank you so much, Doctor.